the same thing goes for major surgery also. Patients have various expectations, okay, especially, if you're doing an orthodontic procedure, jaw correction procedures, you explain to the patient, this is how you're going to look like post-operatively, post-surgically, okay? This is you tell them this is the best we can achieve. Of course, the results of that is all going to depend upon your, the pre-surgical orthodontics, and explain to the patient how you're going to look. There are many softwares. I don't have that software, but there are some. So, if a procedure like an orthodontic surgery, if you have a software that, I don't have that software, but there are softwares available. That's quite expensive. The licensed versions are quite expensive, where you can actually show how a patient's going to look like post-operatively. It basically uses Photoshops and computer graphics to show how the patient's jaws will move forward, how they will look post-operatively. If you have all this, you actually get very good patient compliance. It's a very good, educational and I would say a counseling tool for the patient. That is about orthodontic surgery. The other rare, one of the most challenging major surgeries that I have, very rare. I don't do it very often, but rarely I do is rhinoplasties. Rhinoplasties. The problem is, I don't do corrective rhinoplasty. I don't do aesthetic rhinoplasty. I do what's called cleft and corrective rhinoplasties. Corrective rhinoplasty is somebody who's had an accident, a few months or a few years back, and they probably have a crooked nose. They probably did not get it corrected that time. They later come for a correction. So these are called corrective rhinoplasties. So whenever you're doing a rhinoplasty for a patient, you should always tell the patient that there is not going to be 100% improvement. There will definitely be an improvement, but he's not going to look like Salman Khan or somebody. There's going to be, the shape, the overall shape, and the dimensions of his nose will not change. It will become like before. You can't really make him, into somebody he is not. So that is what about rhinoplasties. You have to explain very clearly to the patient, I can make a 90% improvement, but making it 100% is much more difficult. Actually, getting from 90 to 100 is much more difficult to get there rather than getting from 0 to 90. So you can explain this to the patient. I also do occasionally I do cleft rhinoplasties. For patients who cleft lip palate patients, when they grow up, when they reach adolescence and adulthood, they always end up with nose deformity. That's known as a cleft nasal deformity. In those conditions also, there's going to be improvement, but it is going to look near normal. Okay, the important word to remember is it'll be near normal, but it won't be normal. So explain to the patient that nose will definitely improve, but it will not become like a normal person's nose. So explain to them before itself. Nobody can make it normal. There is, except God, nobody can make a cleft rhinoplasty, a cleft nasal deformity nose normal. Okay, you can make it 85%, 80%, 90%. You cannot make it 100%. So rhinoplasty is explained very clearly to the patient beforehand. When you sit with a patient and explain to a patient, you are basically avoiding disappointment. Okay, patients should not be disappointed. Never promise them the world. Okay, never promise them the heavens and never promise them the world just to advertise and market yourself. Be realistic. Tell them this is what I can do. Okay, if you feel that I am not good enough, you're more than welcome to go elsewhere. Okay, never overestimate and try to sell yourself into something which you cannot deliver. Okay, that's very in surgery is very, very important. Okay, never bite more than you can chew. Okay, so this is what I can do. Okay, this is the best result I can do. Explain to the patient. It's up to them. Okay, I will charge this much my hospital will charge you this much, my charges are this much, this is what I can deliver. You want to look like, you want to look like Karishma Kapoor or, Anil Kapoor, you please go somewhere else. I can't make you look like that. So,
Sure. Well, that's it.
So, in surgical practice, that is, especially in private practice, it is very, very important. Communication is very important. Take time to sit with the patient and explain. Never, delegate this task to a junior or assistant or, a BDS staff or a sister. Do it personally, sit with them, show them your other cases. Show them your previous cases that you've done, show them, what results you can achieve. Tell them, I can get you this much, I can get you about 85-90% result, I can't give you 100-110%. Explain to the patient. All these things are done to avoid disappointment later, and to have realistic expectations, okay, from the patient rather than unrealistic expectations, and do not try to sell something that you cannot deliver. So this especially, it's very true for aesthetic procedures, like orthodontic surgeries, rhinoplasties, where facial cosmetics are involved, these kind of counseling and I would say,
Understood. I got the point.
I forgot. I also, among the minor oral surgical procedures, I would also like to say that if you're doing implants or something, I'm sure you would have interviewed people who have done a lot of implants, general practitioners. Always explain the costs involved. Okay, apart from the technicalities, apart from the surgical challenges and the technicalities involved, always explain the costs involved. There are various types of implants. Dental implants, all different grades are there. You have the Nobel Biocares and the Zimmers that are the high-end implants to to low level, I would say entry-level implants, much cheaper implants that are more affordable. Explain the costs of the implants, costs of the laboratory procedures, because implant is something where it costs a lot of money, right from the hardware, the implant, to the prosthetic face, So have all these costs explained to the patient beforehand, okay? Because it will go into a couple of tens of thousands of rupees, So have these costs are very important. And of course, as explained to you about the surgical complications and challenges as with an impacted tooth, also explain the same with an implant. If you're going to use any bone grafts, whether you're going to use autogenous bone grafts, but that's from the patient's own tissues, own bone, or you're going to use an artificial substitute, explain to the patient all those things, So that is briefly about, talking to the patient in minor surgery and major surgery. Also, sometimes, you do get, just like, rhinoplasties, you also get secondary deformities, So patients, what's known as secondary traumatic deformities. These are patients who would have had some accident a few months or a few years earlier, and they come with all sort of issues. They can't. It could be either functional or aesthetic or cosmetic. Either they cannot bite properly, or they probably have some TMJ problem. They could have a jaw deformity. They could have a nose deformity. Some sort of they could have a orbital deformity, a secondary orbital deformity, or a deficiency of the cheek or something. So these are again very similar to aesthetic procedures, So explain whenever the cosmesis is involved, whenever facial aesthetics, facial cosmetics is involved, explain to the patient that this is the best you can do. You can improve their cheekbones and their malar prominence to this much. If the orbits, if the orbital region is not looking normal, you can improve this much. If so cosmetic expectations are extremely important when you explain. Tell the patient, I can make you 90%, 95% normal, near normal, but not 100% normal like before, because of the complexities of his challenges, you know.
Exactly.
Never
That-
simple
that's-
world, yeah.